Hello, my name is Gordon McCall. This is a video for the competency test for the insertion of the oropharyngeal and the nasopharyngeal airway. First, I will review the chart to ensure that the doctor ordered the oropharyngeal airway for this patient. Next, I will gather equipment, which includes the oropharyngeal and nasopharyngeal airway, the lubricant for the nasopharyngeal airway, hand sanitizer, and disposable rubber gloves. I will follow that with performing proper hand hygiene. As I'm doing the oropharyngeal airway first, it is noted that the oropharyngeal airway is only used on unconscious patients to secure the airway and keep the tongue out of the way of the airway. Then I will perform vital signs on the patient, most notably the pulse, since they are unconscious, I want to make sure that they don't need CPR. Next, I will measure the oropharyngeal airway at the corner of the mouth to the corner of the jaw, just so the flange sticks out. Next, as I insert it, I will position his head, insert it sideways, and rotate it to where the tongue is now out of the way and the airway is secure. After doing so, I will perform more vital signs and reassess, and then I will document everything into the patient's chart. Now, onto the oropharyngeal airway, or the nasopharyngeal airway, I apologize. I would then start by gathering equipment, which is the nasopharyngeal airway and the lubricant, as well as the hand sanitizer and rubber gloves. And as I go into the patient's room, I would review the chart and ensure that the doctor ordered the nasopharyngeal airway. Hello, my name is Gordon McCall. I will be your respiratory therapy student today. The doctor has ordered us to perform a nasopharyngeal airway insertion, which is just a little tube to make your breathing easier and open your nose. Can you verify your name and date of birth? Thank you. Now I will perform proper hand hygiene again. And with that, the nasopharyngeal airway can be inserted on a conscious patient, and that is why you verify their name and date of birth. And when measuring for the nasopharyngeal airway, you'll line it up at the corner of the nose and bring it to the earlobe, allowing the flange to stick out. Before putting it in, you will use lubricant to allow the tube to slide easier through the nose. When inserting it, you're going to want to use gentle but firm pressure to allow an easier way to insert it into the nose. And then you are going to want to look at the nares to decide which one is bigger, and you choose the bigger one first to insert it because it will be easier to get through as you're inserting it. If If you run into any trouble, give it a slight twist. And then you're going to want to continue through until there's a little space left and the flange is sticking out. After doing so, you're going to want to potentially use a tongue depressor and just ensure that you can see it in the back of the throat. With that, you'll reassess the vital signs and then chart down everything in the patient's chart.